One of the skills you may be asked to perform when you take your state exam is to provide client with passive range of motion exercises to one shoulder. The client needs his or her shoulder flexed and extended and abducted and adducted. For testing purposes, the client needs 3 repetitions of both exercises. The instructions provided at the test site will indicate whether the exercise is to the left or right side. The role of the resident client is played by a person. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Instruct client to inform you if pain is experienced during exercise. Support the client's upper arm and lower arm to protect the working joint while performing range of motion for the shoulder. Raise client's straightened arm from side position upward toward head to ear level and return arm down to side of body. Flexion, extension, at least 3 times unless pain verbalized. Supporting the limb, move joint gently, slowly, and smoothly through the range of motion exercise, discontinuing exercise if client verbalizes pain. Move client straightened arm away from the side of the body to shoulder level and return to side of body. Abduction, adduction, at least 3 times unless pain verbalized. Supporting the limb, move joint gently, slowly, and smoothly through the range of motion, discontinuing exercise if client verbalizes pain. Make sure signaling device is within reach and bed is in low position. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate greet resident, address by name, and introduce self? Provide explanations to resident about care before beginning and during care. Exercise correct joint and correct side when performing range of motion. Support extremity to protect the working joint throughout range of motion exercises. Move shoulder through range of motion, raising and lowering arm alongside toward head of bed and back to mattress. Flexion, extension. Move resident shoulder through range of motion, taking arm away from side and back to side. Abduction, adduction. Ask resident to report discomfort during range of motion or ask if resident has discomfort during range of motion exercises. Control extremity throughout range of motion exercises, providing smooth, slow, non-forceful movement. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.